Good morning. As part of Missouri Kids First Essential for Kids campaign, we are speaking with experts in the field of child protection here in Missouri. And today I'm really excited to speak with Dr. Jamie Kondis. Dr. Kondis is a child abuse pediatrician at St. Louis Children's Hospital. And we just really want to speak with her about issues impacting child abuse neglect during COVID-19. So I think we'll just go ahead and dig in. So
Okay.
Dr. Kondis, as a child abuse pediatrician, what issues are of most concern to you right now?
Thank you for having me. There's a couple big issues that we're concerned about. One of them is that we're really concerned that we're not seeing all of the children that we typically would see. So the spring is actually usually when we see the most hotline reports in the state. And there's a couple theories for that. We think sometimes teachers are getting towards the end of the school year and they want to make sure that kids are reported that they might not see over the summer. There's awareness campaigns going on in April, so I think sometimes that brings more reports. But right now, we've actually seen the opposite. Reports in Missouri have fallen dramatically since March by more than 50% for both physical abuse, sexual abuse, and neglect. So we're really concerned about those kids that we're not seeing. We don't think the rate of abuse has fallen at all. We think that it's just not getting reported. The other thing that we're really concerned about is a spike in serious physical abuse cases. So we know from research that's been done during other periods of big societal stress, such as economic recession. There was a lot of research done during the economic recession in 2008, 2009. Also things like hurricanes and other natural disasters. We know that the rates of serious physical abuse go up during those times because we think that families are under a lot more stress, and so they may take that out on their young children who are in the home. So we're really worried that we're going to see that spike in abuse. And so those are the two things that we're really concerned about right now.
Why is it that you see a spike in physical abuse cases? Why is that something that you think could be happening right now or has happened in the past?
Yeah, so there's a lot of factors that have been studied over the years that play into why we have physical abuse. There's personal risk factors, such as if you were abused yourself or if you use substances. There's family risk factors, such as if you live in a family with domestic violence or you live in a family with mental illness or substance abuse. And then there's societal risk factors. And the societal risk factors include things such as cities that have higher rates of violence. We know that we see higher rates of child abuse in those cities. Cities that don't have good frameworks for supporting families, like food banks and daycares and home visitation programs and things like that. We know we see higher rates in those cities. And then the other thing that has been really well studied is things that put intense stress on cities and families are known to increase the rates of abuse, just because sometimes families just have trouble coping with those big major life events like economic recessions and natural disasters. So with the current COVID-19 pandemic, it is causing a lot of economic stress. People are losing their jobs. People aren't working. It's also causing a new problem that we've really never seen with a lot of the other natural disasters, and that's that everybody's at home. You know, even with the recession, kids were still going to school, kids were still going to daycare, so there was some pressure alleviated from the family, but now we've got all that economic stress, plus the kids are at home, plus the families are expected to care for the babies. A lot of daycares are closed, a lot of schools are closed, and they may not even open up in the summer. They may be closed until at least the fall. And so we are not surprised at all if we start seeing really much higher rates of abuse, because there's just even new factors that are weighing in addition to the ones that we already know are risk factors.
So what steps do you recommend we take here in Missouri, in our own communities, and our families? What can we do?
Yeah, you know, it's been rough here in St. Louis. We have seen some spike in some very severe cases, as well as less severe but still very concerning cases for both school-age children and young infants. So, you know, I think as long as schools are closed and daycares are closed, we're going to continue to see that stress on families, plus until the economy gets back up and going. So I think one thing that people can do is, if you know a family that has young kids, as things start to open back up and people feel comfortable maybe going to check on families, or at least giving them a call and seeing if there's any way you can assist them, if you can bring them groceries, or if you can, you know, as things start to open back up, maybe you can watch their kids for them for a little while. But I think we just really need to be checking on our friends and neighbors and really making sure they're okay. And if we have concerns about safety in a home, I want people to be reassured that it's okay to call the Missouri Child Abuse and Neglect Hotline. It doesn't have to be seen as a accusation or a punitive measure, but really a request for help and services to a family. There are a lot of services out there that families may not realize that they even exist, or they may not know how to access them. But when Missouri Children's Vision gets involved, they actually have more opportunities to access those resources. So I don't want people to think that hotlining is necessarily a bad thing, because it can actually open up more resources sometimes for a family. And for families themselves, you know, I don't want people to be afraid to ask for help. There's a lot of organizations that are still functioning. The crisis nursery is still functioning right now, and they've taken a lot of steps to make sure that things are clean and healthy at the crisis nursery. So that's a place families can turn to for help. There's also food banks are still open. They want people to come. There's a lot of other organizations that usually do home visitation that may not be doing that right now, but they are still offering things like virtual visits and things like that. So I want families to still feel like they can ask for help. And if they need to step away from their kids for short periods of time, they should definitely do that before they get to that breaking point. But I definitely want people to be asking for help during this time, because we all need to recognize that this is a very intensely stressful time for everybody, from caregivers to families. And so it is totally okay to ask for help right now, and we should be doing that.
All right. Well, Dr. Kondis, thank you so much for your time today and for your advice.
Thank you for having me, and thank you for highlighting this important issue.